Thank you to everybody. I'm Alessandro Tardani. I'm a dentist from Italy, and today I will show you how the magnetic mallet can be used to improve your everyday surgery in your dental office. So, what is it? Magnetic dynamic technology. Magnetic dynamic technology is about these tools, this machine. This machine is composed by three principal pieces. The first one is the tools. The tools are many tools that we will show you during the presentation and can help us achieving various jobs like extraction, placement of implants, or sinus lifts. Then we have the adjustable power that can help us to regulate the power the machine can release, and at least but not last, the handpiece. The handpiece is the core of this machine. So let's see what this handpiece do. When we press with our foot the button, two magnets impact down inside the handpiece, and so in just 50 microseconds we create an impact with an acceleration of 5000 g, and we can deliver a force that can arrive to 500 kilograms. So we will see now what? The graph. This is made by the University of Milan and compare what? In blue, green, red and brown, the four adjustable powers that magnetic mallet can release and the time in which they are released. In violet, you can see a manual mallet, and what we will see that if we go manual, we give a long time and a little power. So the patient feels discomfort for a long time, and we cannot achieve what we want in a little of time. These are some of the tools that we can use, and I will show you after in this presentation. This is the first video of this presentation, and it's about how it works with an extraction. So just see together it, and then.
The magnetic mallet is an innovative device created specifically for oral and implant surgery. It is used for multiple applications in dentistry and is extremely efficient as well as exceptionally safe. Let's see how it works for extractions. The extraction kit contains 10 instruments that have been designed to treat all types of extractions, including third molars. These instruments do not wear out and therefore do not have to be replaced. In this surgical video and rendering, we show you how an ankylosed root is extracted in a short period of time with outstanding results. The 5000 G-force of acceleration provided by the handpiece allows for straightforward insertion and an almost imperceptible impact for the patient, making the procedure a comfortable and quick experience. In addition, the speed ensures that it does not generate any heat on the bone. The shape of the blade has been developed to easily slide between the root and the bone, which perfectly conserves the tissues while detaching the root. The handpiece is easy to direct at the necessary angulation, ensuring that the buccal plate remains untouched and the root is not exposed to the risk of fracture. Soft tissues and bone are saved, while the perfectly preserved root is effortlessly extracted. Technology for minimally invasive surgery has moved forward. Magnetic mallet. Try it.
Okay, so you have seen a first video, and just to understand how it works. So we can see a little case about the extraction and the implant positioning made by freehand. So we can see a case where we can see two rods in position 24 and 25, and this is a photo of this kind of extractor that can help us achieve our first result. So this is the extraction done. Then in 24, with our black ruby tree, we can achieve a new alveolus for our implants. And then after the, the implant placement, we can elevate the sinus with our elevate. So we open a flap and we can condense the bone till we reach the height with the zither we want. And then we can easily place the implants. You can see the radiography, post-operatory radiography, and the suture on our implants. So we can see what are the advantages of magnetic dynamic mallet. We have speed because as I told you before, we release our power in a very, very small time. Is versatility because we have a lot of tools that can help us achieve what we want during our surgery. It's directionality and visibility because it's a long instrument that don't block our vision during the surgery. We have control because the handpiece is very easy to keep in our hand and don't slip easily. It's cold. This is one of the best feature of the magnetic mallet because we don't produce any heat because there's no drilling and no cutting. So we can preserve our bone at the maximum we want. And at the 8 we have accuracy, but this is better with what we will see in a little of time, that is guided surgery with magnetic mallet. So this is the kit for the guided surgery with magnetic mallet, and is composed by 5 instruments and 5 stops that help us to reach the depth we want with our implants. So a little video. Okay, now we will continue. And as you can see, for digital and guided surgery, we are supposed to use a software that allows us to combine the radiographic data with our STL file in order to create a project where we can see the final result we want to achieve. And then we can proceed with the creation of a guided tool that that help us to place the implants in the position we want to put in. So this is the advantages of using the magnetic mallet in guided surgery. We eliminated the problem that is firstly correlated with the guided surgery. So is the heat, because the water during the drilling is very difficult that can reach the bone during the perforation. Using these tools, we can achieve a perfect perforation of the bone without any heat inside. So I'll show you a female patient of 56 years old that needed 4 implants in the upper arch. So we prepare a project, and I'll show you one thing that is the most important thing to evaluate before using the magnetic mallet, that is the density of the bone. So with our software, we can control and determine the density of our bone. So you can see on the left of the screen the first implant where you can see there is a D4 density, so a very uh, uh, a bone. Oh, sorry, I don't remember them. Not thick. It's a and so we have a lot of spaces to put our implant. In position 0, where we have the implant, we have a D3 density. That means it's a good places to use the magnetic mallet because it's soft enough, you know. But we have to be a little bit more precise because we can reach a density of the bone that became too much for the implant insertion. So we have to understand that not drilling but pushing our bone can result in a very hard bone. So let's check the other implants on the other side, and we can see 2D3 density that can give us a good vibe about the use of the magnetic mallet in this case. So we'll see at first the patient. We used mucotomy because the gum was thick enough to permit us to create a little circle. So the surgical guide was put in position and fixed by a pin on the right side of the patient. Then we start with our magnetic mallet dynamic surgery. So you can see the tool and the stop that fits perfectly in the surgical guide from one side and in the other side. So you can see in these two photos that on the left is the stops is in the first part of the surgical guide, and then there is a stop on it that block the perforation. So you can see the 4 implants in position and the 4 healing abutments. Now I'll show you what. This is a superimposition made by the first project and the control radiography that was taken months later. So what you can see, you'll see 4 yellow pins and 4 white pins. The 4 yellow means the real position of the implants, and the white pins means the original, the project position of the implants. So there is a little bit of difference, but as you will see, is about 3-4 degrees, so a very little difference. In another perspective, I've made the superimposition. In blue there are the project, and in yellow there are the real one, and are very similar. So I show you what. This is another image where we made the superimposition of the two images, and we will understand the importance of being guided so we can put our implants in the position we want. And this is a little bit of bibliography about the usefulness of the guided surgery. We can see in the last 10 years a lot of authors wrote articles about this, and we can see that the angular deviation freehand or guided is really different in every study published from 2010 to now. And what is this? These are two radiographics made by two implants placed years ago that seems to be placed in a good way, I think. But now we will see only in two dimensions. If we want to check it in reality, we have to put our attention to the third dimension. So let's see this way. These are the superimposition of the, just like before. We put the initial project with the result. Here we used the impression we took when we finalized the cases. And we will see that free-handed will have a difference that is very, very visible. The two pins are not one on another, but they are there is a very visible angle between the two. So we will see another patient. This patient is a male of 46 years old and has 4 roots that needs to be removed, and we decided to replace them with 3 implants. So the first thing to do is the evaluation of the density of the bone. And what we will see in here, that our software made a mistakes because it cannot distinguish between bone and the tooth. So we have placed our virtual implant in the right position. So it for the software it reads bones and the root. So in the first part where the bone is D4, he released the apex of the implants. Where we go to D2, we are reading the density of the root of our tooth. The same goes here. So on the apex of the implant, we will see D4, and on the superimposition between implants and the root, we have a more thick bone, but this is not reality. This is only in virtuality. And the same is in here. So we have to understand what our software means when it told us these informations. So this is the case in mouth. So we proceed using the mallet with the extraction of the 4 roots. Then we placed our surgical guide and we used our stops with the mallet to achieve the perfect length of perforation for our implants. You can see on the left side the precision of the positioning of the implants through the holes in the surgical guide, and after the removal, the position inside the mouth, then the healing abutment and the suture for the healing. Okay. Another patient. Here we have a little bit of split mouth case. On the right side, we have to remove a root. On the left side, we have a root that has been removed years ago. So we do the same. So we check the density of the bone. We put our virtual implant in place and we check what our software gives us. And so the result is the same just like before. On the apex of the implants, we will see D4 density, so a soft bone. And the part in D3 and D2 are referred to the part of the implant that is positioned superimposed to the root of our tooth. In fact, on the other side, where we have put our implant in the native bone, we can see that the relevation of the density of the bone is more correct. In fact, we have a D4 density. That's the perfect density to use our magnetic mallet that give us the big advantage of create a better density of the bone for our implants. So you will see there are on the right side of the patient the root that has been removed using magnetic mallet. Then we placed our surgical guide. In this case, we opened two flaps because we wanted to keep all the gingiva. So we started with our preparation. Here you can see the carrier for the mounter for the implants in position on the right side, and on the left side the implant positioned. Then we put the healing abutment and the suture. Now we will see another kit of tools made to elevate the sinus. So the sinus lift, in fact, these instruments are made without with a plain hand that help us to elevate the bone near the Schneider membrane. So let's see a little video. This is as not people speaking, so I will comment on it, but you can read the words that are on the side of the video. So we start using our drilling, making what? We have to control the distance between the bone and the membrane. So we put the stop 1 or 2 millimeters away from the end of the bone with the smaller instrument. Then when we have achieved a good diameter of entrance, we can use the second instrument with a stop that is at the length of the bone to push the last part of the bone on the membrane, and it can elevate depth and help us to reach the wanted height. So in this case, that is a little bit more complicated than the ones you have seen before. We have, let me show 1, 2, 3, 4, 8 extraction to do and 5 implants to be placed. And on the most left side, we have to perform a little bit of sinus lift. So we start with the a partial extraction because we wanted to have a better positioning for our surgical guide and a better stability. So we decided to perform only the extraction needed for the implant placement. So we start with the tools for the extraction and we extract 4 elements. Then we proceed with the mucotomy in the position needed for the placement of the other implants that were not post-extraction implants. And as you can see in a three-dimensional wave, we can see the implant is longer than the bone we have, so we have to perform our sinus lift. And this is a little tricky because the kit for the elevate of the sinus is not born to be used with a surgical guide, but is fortunately the dimension of the stops of the elevate kit fits perfectly between the holes of the surgical guide. So with a little bit of practice, we can use it to achieve a very precise elevation of our sinus lift. So you can see the 5 implant placed with the multi-unit abutment on top and the pre-milled provisional in occlusal view and in frontal view given the same day of the surgery to the patient. Sorry. So how and what application we have with our magnetic mallet? We can use it for extraction. We can use it for sinus lift. We can use it with guided surgery. We can use it for pin fixation system. We can use it for crown removal, for horizontal expansion, osteodensification, that is one of the most important part for the use of the magnetic mallet, and last but not last, implant site preparation. Here you can see a lot of clinical cases that you can find on the YouTube channel of Osseotouch. These are just a little bit of example. And moreover, you can find a lot of animated videos that can show you all the use you can do with your magnetic mallet in your dental office every day. So I've been a little bit fast today, and I thank you for your attention.